The most important thing about those years is having one person just be madly crazy in love with you.
It's exactly right. We say it's not rocket science, but it is neuroscience. I mean, there is. It's in some ways it's so easy. We think, why doesn't every single baby, why doesn't every child have this available to them?
Legacy Foundation is Lake County's community foundation. For over 30 years, we've partnered with donors and nonprofits, focusing on youth development, the arts, the environment, health, literacy, and other causes that matter to you. We're committed to Lake County forever. First Things First Porter County is dedicated to supporting families, healthy beginnings, and quality early learning, ensuring every Porter County baby is born prepared for a strong start in life. Learn more at firstthingspc.org.
I have a very strong connection to other students. Everyone makes an effort to help each other. I'll remember the feeling of being here, the feeling that I was a part of a family.
Additional support for Building Blocks is provided generously by Tom Sorlis and Sue Eleuterio, as well as Porter County Community Foundation, serving Porter County since 1996.
Building Blocks, the podcast, is a co-production of Lakeshore Public Media and First Things First Porter County. For more information on Building Blocks, including this podcast, as well as the television show, visit lakeshorepublicmedia.org/buildingblocks.
Hi. Today on Building Blocks, we're talking with Maureen Weber, President and CEO of Early Learning Indiana. We're going to be talking about the early learning and education in Indiana, as well as the initiative of Early Years Indiana. So stay tuned, and we'll be talking about these exciting initiatives. Maureen, hi, how are you today?
Hi, nice to see you.
It's great to be here with you. Thanks so much. Welcome to Northwest Indiana, and welcome to Building Blocks. I want to start out and just... I'm not sure all of our listeners would be familiar with Early Learning Indiana, the oldest and largest nonprofit focused on early education. Tell us about Early Learning Indiana.
Yeah, well, first of all, thank you for having me to Northwest Indiana on this beautiful day. It's wonderful to be here and celebrate all the work that's happening here for our youngest Hoosiers. So Early Learning Indiana has been around for more than 125 years now. We were started in the late 1800s, and we do a handful of things. We operate a dozen early learning centers, mostly in Marion and Tippecanoe County, where we serve about 1,000 children between the ages of birth and 5 years old each day. We also then work as a statewide intermediary to share what we've learned over all those years of practice and help to connect community organizations that are all working on different aspects of this problem together. And so happy to be here to move that forward here today.
So First Things First, the organization in Porter County that I work with, has been the beneficiary of your work, your learnings, and also your generosity. So we want to thank you for that. The Early Years Initiative was something that was launched about 2 years ago now. Tell us about the Early Years Initiative.
Yeah, we've had such a focus in Indiana and really all around the country on the pre-kindergarten year and the important work that happens with 4-year-olds to get them ready for that K-12 education experience. And, as we reflected, we really understood that we were in some ways missing this critical time of life, the first 1,000 days that I know you focus on here, to think about how can we influence what's happening in the very architecture of the brain from the very earliest years. And so we launched with the generous support of Lilly Endowment, what we call the Early Years Initiative, which turned into a $55 million competitive grant opportunity. In total, we have funded almost 150 organizations around the state, all doing good work in a couple of areas related to the years between birth and 3 years old. So it's been just an incredibly rich opportunity for us to support other organizations and to learn from them as well.
So what are some of the learnings that have come from this project?
Yeah. Well, we were really focused on 4 things in particular for those years between birth and 3. First, expanding childcare access. This has been a conversation in the state for a long time, and we know that it's one that needs to continue. But there are other things that we can do to help wrap supports around very young children and their families. And so we focused also on ways we might strengthen families through home visiting and other sort of at-home activities that parents can do to make sure that their children have every opportunity when it comes to their learning and development. We were also focused on early detection and prevention and making sure that we were doing the things to identify those developmental needs just as soon as possible so that we can intervene if at all possible. And then lastly, focused on early literacy. And so recognizing that our 3rd grade reading scores start far before a child ever walks in the schoolhouse door to kindergarten. And so our efforts were really in those 4 areas. And so we have early years grantees all around the state in literally almost every single county that are focused on one of those 4 areas. And one of the things that we found, and it won't be any surprise to you, is that we just haven't thought about the earliest years, the youngest Hoosiers, as much as we might. And so we've had a lot of organizations that haven't traditionally served infants and toddlers at all who have come to the fore and started to help with this effort.
So you've received a positive response, but probably some questions about how do we do this?
Well, that's exactly right. Yeah, I mean, I think so many both childcare providers, community organizations are curious about how to start, where to start. And so we created a list of model programs. We kind of curated from all around the country of things that were proven practices that have worked in other places. And we brought those programs and projects to Indiana, as well as understanding that there is innovation happening all around the state all the time. And so we tried to have a blend of those sort of proven models and then other promising ones that are currently under development, and that's what we've done through the initiative.
That's really, really exciting. I know in Northwest Indiana, we've got lots of things, and every single county, as you mentioned, is different. Every local context is different. What works for us in Porter County is different than what is working in Jasper County or Newton County or Lake County across our region. So I think that's also been really interesting to think about how people are addressing this from different perspectives. What would you say was the biggest surprise?
The biggest surprise, that's a great question. I think the excitement that communities literally in every part of the state have to do something for our littles. I think there is an understanding from every parent or grandparent that there is something extraordinary about those first few years of life. And too often we take it for granted. And so I think we were pleasantly surprised by the number of organizations that said, maybe there's something we could do about this, and tried to figure out their piece of the puzzle.
And we're unified by that, by our state, by all being Hoosiers, but just knowing that in every part of the state there's a different approach. We know that in the first 1,000 years, we talk about this probably on every episode and every conversation I'm having, that the most important thing about those years is having one person just be madly crazy in love with you.
It's exactly right. We say it's not rocket science, but it is neuroscience. I mean, there is it's in some ways it's so easy. We think, why doesn't every single baby, why doesn't every child have this available to them? Because really, what you need to at sort of the core are 2 things. It's nurturing environments and responsive relationships. That child needs to know that when they have a need, it will be addressed and by someone who loves and cares for them, and that can happen. Of course, we hope in every case or almost every case in a home. It can happen in a childcare setting and must. It can happen in the community. Really, wherever those children are spending their time, they are learning, and so that's the opportunity we have in front of us.
And so we often think about babies and learning and what does learning look like for an infant, for a toddler? It's very different from a first grader or a seventh grader.
It's definitely different, isn't it? I was at one of our early learning centers this morning, and there was a lot of learning with paint all over my dress. So, it really is about having the comfort to explore and being surrounded by an environment of rich materials that, can capture their interest. And so as children become curious about one topic or another, they have sort of the materials and the individuals around them to foster that curiosity. And I think about it. I'm a horrible gardener, Mary Jane, and but I have in my backyard a set of hydrangeas, and I could never remember which variety I bought, to be honest. And so I feel as though I've pruned them at the wrong time every single year. And I know this because what I have are some very healthy, beautiful green plants. And if I were trying to have green plants, that would be wonderful. But I'm trying to have hydrangeas, and we're missing the pink and purple and blue blossoms that we might have. And I think about that with our very young children, right? We have children in front of us who are entering kindergarten or first grade, and hopefully there are big green plants, right? Hopefully they have most of what they need. But we worry most about what is it that we're missing out on in terms of their potential. What could we be bringing with them as they enter that schoolhouse door that they don't have?
And those solid roots and the nutrients that they all need. Talking with Maureen Weber today, President and CEO of Early Learning Indiana. And we're talking about the importance of growing strong roots into green plants, into these beautiful, blooming Hoosier citizens, and all that it takes to have a solid early learning environment, really those building blocks. So Maureen, you're talking about the gardener, and for me, that really means the early educator in those spaces. Mm-hmm. And we've both been in those environments, and the work that is being done, really those frontline responders. Talk to me about what it means to be an early educator. That doesn't often ring true when you think about infants. They're an educator.
Sure.
There's a mix up there, I think.
Yeah, absolutely. It's so interesting. The state of Indiana did a study just a little under a year ago about early educators and sort of how they compare with their peers in K-12 and elsewhere. And what they found was that almost 100%, 94% of skills overlapped between a lead teacher in an early care and education setting and a kindergarten teacher. And so we really cannot underestimate the importance of those individuals to the well-being of our children now and in the future. And their work done well is magical, isn't it, Mary Jane?
It truly is. You are a brain worker. You are a brain scientist.
That's exactly right.
And I have saved with me, I was at a conference one time, I had a business card from a recruiter at Google, and they weren't recruiting software developers or things like that. They were recruiting early educators for their infant room. And I thought, if I just decide everything else is going wrong, I'm going to go to Google and work with their babies. And it was amazing to me because the way that they had structured their environment was through their compensation. And so we know right now that there's such a disparity between those kindergarten teachers and those who are teaching children just a few years younger, but those skills overlap.
That's exactly right. It's about $8 an hour difference on average across the state of Indiana, whereas kindergarten teachers are around $24 an hour. Their early learning peers are right over $16, and those are some of the higher compensated early educators. Mm-hmm. Certainly that's not everyone across the state, and so I think we just have an enormous opportunity to make sure that we are valuing the tremendous contributions of those individuals who spend, in some cases, 40, 50 hours or even more with very young children at this vital time of life.
And they need so much, and they need that one person to be crazy, madly in love with them. And that's a lot of energy and time and emotion poured into those children. Let's talk about solutions. How do we start to close this wage gap?
Yeah, I think
I know we don't have all day, but
you're saving all the easy ones for today, huh, Mary Jane? Yeah, I think it's an incredibly challenging question. I think what we can do is start by acknowledging, first of all, the value that is provided in an early care and education classroom that is operating in a high quality way. I think we have to make sure that where the government is the payer, and often it is, that it is a good payer, that it is reimbursing for the true cost of care and doing its part in that way. And then I think we have to continue to help the market function. And there are a lot of ways we can do that, right? We can drive towards economies of scale, and we can look at the regulatory burden and make sure that it's in just the right place to protect the health and safety of children without unduly adding costs to the system. And I think it's got to be all of those things for us to continue to meet the compensation that we should be meeting for early educators.
Absolutely. You mentioned the true cost of care. Explain to our listeners what you mean by that. Some people may not understand how that is different from what is being actually paid for and all those complexities.
Yeah, it's a really interesting market for early care and education because two things are true at the same time. We don't compensate early care educators in the way that we might, given the value that they are delivering to us, and we charge more than parents can afford to pay. And so often the way that inconsistency gets resolved is through an early care and education provider making a decision to, perhaps take less compensation herself. A lot of early care and education providers are doing absolutely everything they can to keep costs low for families. And what that means is, unfortunately, that they are often compensating less than they might.
I heard that this morning. I was on a call where there were about 51 educators from across the state. These are small business owners who may have a family childcare in their home. And one woman was talking about how she provides kind of off-hours care for nurses, PAs, people who are in the healthcare field. And she said they just can't afford what it really costs. She said, so I'm subsidizing their subsidies. And we hear that so often.
Yeah, all the time. That's exactly right.
It's creating a pretty massive ripple effect across the economy, isn't it?
It is.
Yeah.
We did some work with the Indiana Chamber of Commerce and to look at a report we call Untapped Potential that showed about $4 billion worth of impact annually across the state of Indiana, including a really hefty amount of taxes that we're missing for our economy.
And those are wages, taxes, lost time that's just not being funneled back into the state that works, right?
That's exactly right. It's lost productivity for businesses. It's all the costs of turnover and having to rehire someone new, and then again the tax implications as well.
We hear a lot of talk right now about the childcare shortage.
Sure.
That's a term that we keep hearing over and over, but I'm not really sure we've fully defined that. So, talk to me like I'm your grandmother.
Yeah.
And explain to me what is this childcare shortage of which we speak?
I think we've talked about it in terms of deserts. We've looked at it a lot of different ways. Our organization does a study each year we call Closing the Gap. And it looks at a number of different things, whether there is childcare capacity in a particular area, what the quality level is of that capacity, if what's available is affordable to local families, and then if families have choices. Can they choose a family childcare home if that is their decision? Can they choose a registered ministry, a school-based center, et cetera? And so one of those factors really is just, is there enough capacity? Are there enough seats, places for children to go in childcare? And what our study has shown most recently is that we have about 62% of the care that we believe that we need to meet the demands from Hoosier workers. And so we've made actually extraordinary progress over the last handful of years. When we started counting in 2021, that number was right around 55%. So we've made progress. We just have a lot longer to go.
And so, the leadership from Early Learning Indiana around those studies, I think, has been really impactful in starting those conversations. In Northwest Indiana, we took inspiration from your work, and we've embarked on a childcare study here.
Yeah,
we're just in the beginning phases. We have identified there's about 5,000 parents across the 7 counties in Northwest Indiana, 5,000 parents who for any other reason except childcare would be back in the workplace.
Amazing. Yeah. I mean, that's startling. It's startling when we think
such a
about
big
where our
number.
unemployment numbers are. And
And so we're, I think together we can maybe make some inroads here. What keeps you awake at night thinking about this childcare shortage?
I think we have made such progress, and the state is currently in a situation of a Child Care and Development Fund voucher shortfall. For those of you who aren't in this every day, that is the primary way that working parents have a subsidy to support child care if they are earning less than 150% of the federal poverty level. And the good news is there's a tremendous amount of demand. People are trying to find care and go to work. The challenge is we currently have a waiting list that is building, and so it's not quite clear today how we're going to serve all of those families. So that's one thing that keeps me up at night. I think the other thing, it relates back to your earlier question. Even where we have seat capacity, we continue in pockets of the state to have a shortage of early care and education workers. And so I think we have to continue to address the needs of that workforce if every other part of our economy and the workforce for all other sectors will be able to work.
And what does that look like to meet the needs of our early education workforce?
I think it's a number of things. It's definitely going after the compensation conversation we had earlier, but it's also about making sure that we are providing great opportunities for our workforce to stay connected to the work. And it's very isolating, as you can imagine, spending that many hours in a room alone or with one other person and a number of young children. If any of you have a number of toddlers, you could imagine that it is both rewarding and challenging. And so I think we've got to make sure we're doing everything we can to care for those early educators and help them stay connected to the work through high-quality professional development and other opportunities, and by valuing their efforts.
I know that one of the, and actually the first time you and I met, we talked about this issue of the qualifications. What does it take to work in this field? And there are many different ways, many different pathways and entry points. So tell us a little bit more about if someone is aspiring to be,
Sure.
And also how do we make this the thing you want to be when you grow up?
Yeah. I hope that when we continue to tell the story of the power that early educators have to transform lives, that will encourage that last part and make it one of the most attractive careers. There are, as you said, a number of on-ramps, and we've made it as easy as we can to enter the profession. There are scholarship opportunities for people who are interested in pursuing a certificate or diploma in early care and education. And so there are lots of organizations, including the Indiana Association for the Education of Young Children, that can help connect individuals with those resources. In our organization, we're also working on alternative pathways that are faster time to productivity so that people can earn as they learn. And I think we're seeing registered apprenticeships from Ivy Tech and elsewhere. All of these things added together, I think, will create lots of different paths that, hopefully one will be the right one for each candidate that might be interested.
There's a lot of different ways. I know we're really excited. We, at our Ivy Tech here in Lake County, on the Gary campus, we have an early care and education, early childhood development program. There's one that will be opening up in Valparaiso campus, hopefully in the next year
Wonderful.
or so. So again, thanks to the generosity of Lilly Endowment, they've been really supportive of that. And, for the first time in my career in early care and education, people are starting to talk about this, and I really do hope that there are people out there who are saying, "Yes, this is where I want to be. I want to be a brain worker, a brain scientist, transform lives," because it is so critically important. So, let's shift gears a little bit. I know you're a mom.
Yeah.
And,
that I am.
when you think about those first 1,000 days with your little ones at home, it's a blur, but what stands out to you? What do you remember?
Oh, amazing! My husband was just showing me a video. It wasn't quite in the first 1,000 days, but of a 4-year-old who is now an 11-year-old just last night, who was crying because she wanted to sew with Grandma, and I needed her help, baking. And it's just amazing to me the willingness to learn at that age. And yes, as a parent, it's a challenge. Our 18-year-old, now 18-year-old, didn't sleep for the first 2.5 years of life. Didn't sleep through the night, and so an incredible challenge as a working mom especially, but to understand what is happening in that time of life and just the opportunity that we have to set them up, not for kindergarten, but for a lifetime of learning in those days was, I don't think I fully understood it at the time. You sort of get it, right? There's something miraculous happening. But now that I understand it more deeply,
Sure.
there are probably a lot of things I'd go back and do differently too. So.
And yet, really, it's just about being that crazy mom who just loves your children unconditionally.
Well,
and,
that's exactly right.
and this accomplishment, right? They get to 11, they get to 18, they head off into their next chapter, and you think, okay, I've got this.
That's right.
The challenges of being a working mom, right? That was maybe what brought you to the work that you're doing now.
Yeah, I think, our children were both served by our day early learning centers, which we operate, and I understood that there was something really important going on in these buildings. And in our case, our early learning centers are very focused on being a place where children in poverty can learn alongside their more affluent peers. And my husband and I really valued that for our own children, and we have not regretted that decision.
And tell
at
us
all.
why that was important to you. Why is that a value?
Yeah, I think all children benefit from having exposure to other children who are different from them. And in particular, there's research that shows that low-income children who are learning alongside more affluent peers benefit the most, and that they have opportunities to see parents who might be going off to work in all different types of jobs, and that has long-term benefit for really all sides. And so, we work really hard to create that environment in our centers wherever possible.
That's really exciting. As we start to think about, kind of next steps in this field, what are you working on next? What's the big knot you want to untangle?
Yeah. Well, I think appropriately, the state of Indiana has been focused on expanding access to childcare, and that work has to continue for the reasons that we've talked about. But I think since the pandemic, we've maybe become a little fuzzier in thinking about what is the quality of those early care and education classrooms, and how do we refocus our efforts there to make sure that we really are making the most of this extraordinary early time of life. And so our focus is, even as we continue to help build childcare supply wherever possible, how do we help those early care and education providers that want to do their very best work, be just as strong as they can be in providing the services that they provide. And so we're doing that through a program we call Building Impact. We're currently serving about 100 leaders across the state that altogether care for more than 10,000 children.
Amazing.
And we're focused on helping them become instructional leaders in their building, not just managers of all of the many, many things that are on their plates, in terms of their human resources and billing and all the things that are tantamount to running a small business. But how do we also help them focus on what's going on in the classroom and how do we make the most of it?
That quality matters.
It sure does, and we've now built the capacity in so many places. It makes every sense in the world to protect that investment.
Absolutely. Just for our listeners who haven't been in early learning environment, what might they see in a quality learning environment?
Yeah, for me, it's really about two things primarily. It's first of all, if you walk in and you see a rich set of materials, and sometimes we use the word curriculum in early care and education, and it causes people to twinge a little bit, I think, because they understand that there is something different about this time of life. But in our case, a curriculum really just means that you have thoughtful things coming in and out of the environment so that children have different things to learn about. And, we might study something as interesting as balls in a toddler classroom, right? Or clothing, so that we have different language that's at use in the environment, and that we're continuing to sort of expand their thinking and their vocabulary at all times. So that's one thing. The second thing, in addition, of course, to the environments and materials, really is about what's going on between the adults and the children in a classroom. And this can happen in a fancy building. This can happen in a very humble building. And I think sometimes we have an idea in our head of what good looks like. Really, what good looks like is a very caring educator who is interacting with the children, understanding what's going on with each individual child and working to extend his or her learning to the next level. And so when you see that happen and you know that you have that loving educator who really understands the child in front of her, it's extraordinary.
It's magic. It's fizzing. I can see it now when I think about environments. What message do you have for our early educators who right now in this moment are feeling kind of beaten down and underappreciated, overworked for sure, and yet they continue to show up every day for families and children? What would you say to them?
I mean, first and foremost, thank you. It really is just unbelievable to me, the challenges that these individuals face, and yet the reward and the payoff is so great that they manage to stay focused on that. Mm-hmm. And I'm in early care and education classrooms all the time, operated by us or by other people, and I am amazed with the consistency that early care and educators they're not focused on some of the challenges that we've talked about today, right? They really are, for the most part, focused on the children in front of them and how to make the most of the opportunity for them.
Thank you so much, Maureen, for your leadership, for your innovation, for your bringing this perspective to our state. I think it has changed the conversation since I have been doing this work my entire career. And so I want to thank you for that. Before we end, is there anything else you want to let us know in Northwest Indiana about Early Learning Indiana or what's ahead for Hoosier families and children?
No, really, I just want to thank all of you. There is so much momentum happening in this part of the state, and all sort of different walks of life, different types of organizations that are involved. And so I appreciate your leadership in bringing those forces together, and the Building Blocks program as well.
We're lucky to have Lakeshore Media along as our partner, and the magic that they put together to tell the stories that are so critical to this work. So again, thank you very much.
Yeah, wonderful.
Legacy Foundation is Lake County's community foundation. For over 30 years, we've partnered with donors and nonprofits, focusing on youth development, the arts, the environment, health, literacy, and other causes that matter to you. We're committed to Lake County forever. First Things First Porter County is dedicated to supporting families, healthy beginnings, and quality early learning, ensuring every Porter County baby is born prepared for a strong start in life. Learn more at firstthingspc.org.
I have a very strong connection to other students. Everyone makes an effort to help each other. I'll remember the feeling of being here, the feeling that I was a part of a family.
Additional support for Building Blocks is provided generously by Tom Sorlis and Sue Eleuterio, as well as Porter County Community Foundation, serving Porter County since 1996.
Building Blocks the Podcast is a co-production of Lakeshore Public Media and First Things First Porter County. For more information on Building Blocks, including this podcast, as well as the television show, visit lakeshorepublicmedia.org/buildingblocks.